I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and welcome to this video. Very interesting patient story to bring to you today. This is a young man, he's 24, comes in with his mum. He's been referred in for dry eyes, and his story is that his eyes are dry, as he's been told they are. Turns out, when you take a story, he's had laser vision correction a couple of years ago, 2 years ago, just over 2 years ago, and 2 years earlier. And he was fine for 15 months. He was about -2.5, had laser vision corrections, and everything was fine. Went overseas, came back, and then started to develop symptoms of dryness and glare in both eyes. They fluctuated. He thought they were slowly getting better with drops, but it was troubling him, and he was very obsessed by it, and his mum was very upset. Now, with all of this, he gets sent in with a referral saying he's got dry eyes. He's 24. I'll be really direct to everyone out there. I've never seen sudden onset dry in a patient without a systemic condition, particularly a young patient. Dry after laser vision correction usually dates close to the laser vision correction. So it's very unusual when a young man gets told he suddenly has dry eye. I have a look at him and I can't see a thing. His optical correction looks perfect. So what's going on? Like everything, and people can become obsessed about their complaints and it can destroy their lives. So he's looking for an answer. I'm looking to try and find the cause. Taking a detailed history, something interesting happens. He admits that he went overseas, came back, and he was distraught on his return. Something had happened to him and his symptoms started from that point in time. He didn't want to reveal it. His mother was there. And he says very distinctly, everything was fine and then suddenly it happened. Turns out he had a holiday romance and he was distraught. She'd cut it off on him and he'd fallen in love probably for the first time in his life. I explained to him the possibilities. I explained to him what laser treatment can do. And I raised it with him that it could be that something happened to him emotionally and he's expressing it in his body. And he was very accepting. I think it's important to do that. One thing you should know as surgeons, it's very easy for us to point the finger at another surgeon and say, oh, look what's happened. The reality was he had a perfect procedure. So I explained this to him, and then I explained him the concept that we all forget about. It's called voodoo death. The witch doctor would point a bone at you and cast a death spell on you, and in 3 months you would die. Not because you had a death spell cast on you, but what I call psychoimmunology. You can mentally give yourself all sorts of problems, including death. Now, we call that psychosomatic, and psychosomatic is real. And what I think has happened is this young man has exteriorized his anxiety over what had happened, and he's created a somatic sensation. In this case, he's placed it on his eyes. The good news is he doesn't require any treatment. The difficulty is he's now going to have to work through what happened to him, and I think he'll get through it. So, not all laser vision correction problems are physical or organic problems. They can be psychosomatic problems. And in our high anxiety society, that's something to bear in mind. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and thanks for watching.